How does user experience affect telehealth digital consent forms? Imagine trying to sign a document on a tiny screen while feeling confused about what you're agreeing to. That's what poor user experience can feel like with telehealth digital consent forms. When these forms are hard to understand or difficult to access, patients might skip important steps or feel unsure about their rights. Good user experience makes the process simple, clear, and quick, which helps patients feel more comfortable and confident. Digital consent forms are electronic documents patients review and sign to agree to receive healthcare remotely. They explain what telehealth involves, including the use of technology, potential risks like privacy issues or technical failures, and the benefits of remote care. These forms also cover patient rights, privacy expectations, and procedures if communication is interrupted. When these forms are well designed, patients can easily understand what they are signing and why it matters. The way these forms are presented plays a big role in how patients respond. Using plain language that avoids medical jargon helps everyone understand the information. Sending the forms ahead of the appointment through patient portals or email gives patients time to review and prepare questions. During the visit, providers should encourage questions and check understanding by asking patients to explain what they understood. This approach makes sure patients are truly informed. For ongoing services like remote patient monitoring or mental health teletherapy, the user experience needs to support easy access and review of consent forms. Some clinics use annual consent updates stored in electronic health records, so patients don't have to fill out the same forms repeatedly. This saves time and keeps everything compliant with state laws. Setting up telehealth appointments involves several steps that depend on user experience. First, providers should check state laws to know if written or verbal consent is needed and how to document it. Explaining what patients can expect during the visit, including privacy safeguards and options for in-person care, builds trust. Digital consent forms should be mobile-friendly and accessible to all, including those with limited digital skills. Integrating consent forms into telemedicine platforms allows patients to complete them easily before or during their appointment, avoiding technical issues. Providers should also document consent discussions thoroughly, especially if verbal consent is used, by noting patient questions and responses. This helps ensure legal compliance and clear communication. Overall, a positive user experience with digital consent forms makes patients more comfortable, builds trust, and keeps everything running smoothly. When patients understand and can easily complete consent forms, it supports better compliance, reduces errors, and makes telehealth more effective for everyone.